Hello, my name is Greg Stock and I'm the CEO of Thibodaux Regional Medical Center. It's a pleasure today to be here with Dr. Borne, who specializes in hand surgery, and we're going to be discussing 2 or 3 of the types of surgical procedures he does to address problems that people have. Maybe we could talk first of all a little bit about hands. Specifically, people may be interested in rheumatoid arthritis and other things that happen to hands and pain associated with it and so on. Tell people a little bit about some of the treatment options for arthritis in a person's hands.
Sure. So arthritis is very common in the hands, and it can come from normal wear and tear arthritis, but also conditions such as rheumatoid arthritis or psoriatic arthritis, those unfortunate conditions. We see it very frequently, and it often presents as either swollen or deformed knuckles. People have a lot of pain with their hands when they go to use them, and it can really be debilitating. If you've ever had a significant problem in the hand, you really take them for granted as to how much you use them for your daily activities. We have a really wide variety of treatment options that we can help manage this depending on the severity. Oftentimes we start without surgery and splints, anti-inflammatory medications, injections into the joints. And then if things really get to be a problem, we've really advanced to where we can replace even the small joints in the fingers, or sometimes if it's severely deformed, we can fuse them, and that really provides some pain relief and good function of the hands.
Let's talk now a little bit about wrists. There are things that are common like carpal tunnel syndrome, but what about scopes, these little scopes that are used now that you're competent with in addressing certain situations in the wrist?
There's a variety of conditions that can affect the wrist, especially inside the joint, and I think most people are familiar with the concept of arthroscopy in the knee, in other areas for a meniscal tear, that sort of thing. Well, analogies exist in the wrist, and we just use smaller equipment, but we can really diagnose the best in the wrist, more so than an MRI or these fancy tests, by looking inside with the camera. And then once we diagnose what we see, oftentimes we can treat it arthroscopically, which is a minimally invasive approach and allows for a little less tissue dissection, quicker healing, and sometimes better results. So we can certainly do that here for a variety of different conditions.
That's impressive. So let's go to the third thing here on my little list of questions, and that's the elbow. And be specific here a little bit around, mostly little boys, it could be little girls too, that are throwing baseballs and doing it repetitively, and the wear and tear on the elbow. And why don't you comment on that, because I know you see quite a few of those patients.
And within the pediatric and adolescent age group, we do see quite a bit of patients coming in with elbow pain, especially people who are throwing quite aggressively and quite frequently. The biggest treatment for that is really prevention and education, and we give talks to coaches and players and families about using appropriate pitch counts, that sort of thing. Certainly once pain develops, it really does require an evaluation. We really test the elbow for stability. Sometimes we'll need advanced imaging with an MRI, but sometimes we can follow it just on clinical exam. And then really managing that pain as best we can without surgery. Oftentimes, if the pain does come up, shutting that pitcher down, allowing them time to rest and their body to heal. Most of these injuries are really true overuse injuries. So these kids are playing year-round baseball, playing travel ball, playing for school, and their elbow doesn't ever get a break. And that pain is really the best indicator of your body letting you know that you're doing too much.
Dr. Borne, it's been great to have you here today.
I'm certainly happy to be here. Thank you.